your new book. So, moving on to our next session, we have a keynote with Alison Nyman, the CEO of Mindful Philanthropy, where we'll be looking at the landscape of mental health philanthropy, which I am really looking forward to understanding more about. So, Alison, over to you.
All right. Well, thank you. And thank you to This Can Happen for inviting me to be with you today. It is such a pleasure to be with you. And I'm excited to tell you a little bit more about mindful philanthropy as well as our work. So there we go. I'll just go back a few slides. So we're going to talk today about the landscape of mental health philanthropy and its impact on workplace mental health. I serve as the CEO of Mindful Philanthropy, and our mission is to increase funding to mental health addiction and well-being. We are a catalytic force within the mental health space, and we were founded in 2020 with the mission of increasing this funding with four funders who had foresight to know and to elevate the need for high impact programs and funding that would fund those programs. So we are laying the critical groundwork today to make sure that mental health is critically funded. And we know that it's not just a hope that we have for this sector, it actually is because we know that the funding needs to match the need for mental health services that are out there. It really is the only way forward. So I'm going to tell you a little bit about how we achieve our mission. We work currently with all kinds of philanthropic funders. So everyone from a corporate foundation to an ultra high net worth individual to a family foundation. And currently we have about 1,000 funders that are in our network and 600 nonprofits that we work with. So first we connect and we convene funders. So we bring them together, we expose them to researchers, to experts that are in the field, and we help them know how they can collaborate with one another to achieve impact faster. Second, we guide philanthropists with foundational research and a strategic roadmap for funding mental health. And we're going to dive into this more. I'll tell you more about all of our guidance in a minute. And then finally, we uplift emerging and innovative solutions in the nonprofit sector. So I'm excited to dig into some of our guidance today. So we know that philanthropic funding for mental health in the United States significantly improves overall well-being, including workplace well-being. And I'm excited to talk about that. And our hope is that we will continue to see increased funding in the United States and globally. So as I mentioned, Mindful Philanthropy has a full suite of guidance. So at the top, you can see that we've had some different guidance pieces on supporting crisis care, supporting youth, supporting culturally led programs. And we've also had some primers that we have researched and put out into the field. And this is because mental health is a foundational issue area that intersects with so many other things, such as climate, homelessness and housing, and sports. These are issue areas that funders care about. And so we've created a primer series that help funders get up to speed and know how to integrate mental health into the things that they care most about and help them have more impact in these issue areas. At the bottom, you'll see an initiative that we did over the last 2 years around the mental health of women and girls, which we see as a strategic initiative and lever for increasing mental health and well-being in our communities and in our society. And in the middle, you'll see what I'm going to talk most about today, which is a series called Mental Health at the Center. And this is an initiative that we formed about 1.5 years ago when we started hearing from funders that there were significant barriers to funding mental health and well-being. There was a lack of vision, there were a lack of goals. There wasn't a clear way to fund, like what should we fund? What should we be focusing on as we set out to fund in this space? And so we started creating a 4-part series called Mental Health at the Center. In addition to the guidance, we paired it with some of our convenings where we were on tour around 7 cities in the United States over the last 9 months. So last year, about this time, we released the Case for Philanthropic Investment. And this is meant for anyone in the C-suite. It's meant for boards, trustees, that they can see how investing in mental health and well-being is critical for success in so many other areas, including workplace productivity. And so in this piece, we highlight the intersectionality of mental health and other issue areas and lay out the financial case for investment. The second is the roadmap for strategic investment. And this is where we lay out the 5 priority issue areas of if you're going to invest in these areas, these are the 5 topics and issues that will have the most return and that we see as being the most beneficial for increasing the overall systems transformation that we're seeking to achieve in the United States and globally. In it, we lay out 5 priorities. So I'll run through them quickly just so you have them at your fingertips, and then you can go through them in more detail on our website. But the first is community, and this one is really key for workplace well-being. So thinking about how do we reduce isolation and loneliness, which we know has been a huge and increasing issue here in the United States? How do we accelerate belonging and purpose and meaning? And we know that especially younger generations are looking for more purpose and meaning in the workplace. The second thing that we highlight is youth and their support systems. And this is critical as we think about the current workforce and the future workforce. The third is crisis. How do we make sure that someone that is in their worst day when they need access to services is able to get them when they need them? The fourth is thinking about workforce, and this is a critical issue for mental health. There is not enough workforce, or it needs to be rearranged here in the United States in particular. And we hope that by highlighting and accelerating workforce strategies and innovations in this area, that we can accelerate access to mental health services. And then finally is implementing what works. We actually do know what works in the mental health space, but it needs the funding in order to scale and to see the success that it needs and to deliver the services. And then lastly, where we're going to do a deeper dive today is actually the US funding landscape. This is a report we released just a few weeks ago that chronicles what are the funding levels in the United States and how can we increase them. So let's do a little bit of a deeper dive now. The first thing I want to highlight is how the report is broken down into 3 sections. The first is the philanthropic snapshot, which I'll go through in a minute. The second is trends in giving areas. And then finally, how do you increase giving and what are those levers to get there? So let's take a look at the philanthropic funding snapshot. So most Americans and far too much of the global population, mental health is at risk. Nearly a quarter of all US adults are affected by mental health disorders each year. And recent research shows that over half the world's population may experience a mental health disorder by the age of 75. And this costs the global economy trillions of dollars annually. So funding needs to match the need that's out there. So in 2015, there was a study, and we saw that 1.2 billion in funding is what was headed to mental health from the philanthropic dollars. Recently, that has increased over the last few years to 2.3 billion. So we are seeing an increase in philanthropic dollars that has happened as a result of the awareness on mental health, increasingly as a result of the pandemic. But then we see that still it's only a marginal fraction of total annual philanthropic giving. So that green piece is the total pie of philanthropic giving, and it's around 1.7%. So it's not quite on par in matching need that is out there. So let's take a look at the trends in the giving areas. We know that 83% of funders that were surveyed are giving or are interested in funding youth mental health, which is incredible. And we applaud that because everyone knows somebody, probably a youth, a niece, a nephew, a son or her daughter, who might be struggling with anxiety or depression. And so we do think that funding needs to go to youth mental health. And we say to their support system, because the support systems, whether it's parents or caregivers, those are the ones that give access to care. Recently in August, the Surgeon General released a new advisory around parent stress, which is increasing. So it's about 33% for parent stress that have youth that are struggling with mental health, as opposed to 20% of the rest of the population. So supporting youth and their support systems is critical, and we're so grateful to see the trend in this area. The second is prioritizing well-being. This one we're going to talk a little bit about, but we do see more and more people starting to support well-being, and that is really the umbrella over mental health. So I think it is an easy on-ramp to being able to support mental health, and thinking about overall, how do we support kind of the promotion and the prevention side of mental health. Third, we know that a lot of people come to the mental health sector because of a personal why or a personal reason. They saw a loved one struggle with a serious mental illness or a challenge, and so that drives their desire to get into the space. And these experiences guide their giving. So they may be funding in very niche or focused ways, and yet while that is good, it also leaves some gaps that need to be addressed. And that is the increasing need for attention to systems change. And we're starting to see a few funders pick this up and notice that there needs to be more giving to the structural systems and to actually build the field of mental health so that people can have access to what they need. So 55% of Americans indicated that they were thriving prior to the pandemic. And then there was a significant 9-point collapse as of April of 2020. And only 34% of employees are thriving in their overall well being now. This low global engagement costs the economy almost $9 trillion, or 9% of the global GDP. And this highlights the critical role in workplaces, especially for engaged teams in driving positive outcomes. And then finally, I want to talk a little bit more about some examples of corporate giving. So there are corporate entities that have been incorporating mental health and well-being initiatives into their workplaces and translating that to their foundation. And we've had the privilege of working with all three of these examples. Morgan Stanley has committed over 50 million to its Alliance for Children's Mental Health since 2020, advancing transformative solutions through innovation awards and driving greater impact for children of all ages, not just with the dollars, but also with in-kind donations that they're able to give. Kate Spade is doing social impact work focused on providing women and girls access to mental health resources. And it's rooted in their cultural humility and making sure that they have a sustained voice and choice and empowerment in the work. And then finally, Pinterest has given over $20 million to 60 nonprofits around improving mental health, emotional well-being, and equity. And so the levers for increased funding, you see that supporting policy and advocacy, investing in data and evaluation, prioritizing scale, and collaborating for systems change. These are ways that you can make a difference in the system. And so we'll talk a little bit more about these in our report. You're welcome to download that and do a deeper dive. But I do want to prioritize in particular collaboration to make the dollar go faster and further in this sector, and really prioritizing how can we help organizations and nonprofits scale so that they are able to meet the need on the ground and do the work. I also want to highlight that this is a nascent and emerging field. And so data and evaluation investment is needed in order to find the proof points, in order to find the metrics that are needed. And then, of course, supporting policy and advocacy is something that is always needed as we think about systemic changes and policy. And so finally, I want to leave you with a few points, but we know that more funding for mental health creates healthier and more resilient communities, and workplace drive a cultural shift toward this well-being. So 3 things that you can do now: you can focus in your workplaces on building a sense of community and belonging in the workplace. It's a key strategy for philanthropic initiatives so that you can find the places in the organization where belonging happens and really promote those in the workplace. This will go a long way for helping parents and caregivers as they're struggling with perhaps youth challenges, but also finding a way for them to protect and promote their own mental health. Second is providing employees with effective mental health treatment that leads to reduced medical expenses, higher productivity, fewer absences, and lower disability costs. So we know that in the United States, insurance parity is an issue for mental health. And this is a place where companies can put pressure and continue to think about ways that they can make access to mental health services equitable for the employees within their organizations. Access, as I mentioned, is a huge issue. And then finally, a strategic approach for organizations is thinking about a 3Ps framework, which comes from One Mind at Work. So thinking about protecting the mental health well-being, promoting mental health well-being, and providing those services and the things that people need to be well. So mindful philanthropy, as I mentioned, is on a mission to catalyze impactful funding in mental health, addiction, and well-being. And we have a pretty big vision that over the next few years, that we would see a 5-fold increase in funding to mental health and well-being. So we envision that that piece of pie is going to grow to be over 35 billion annually. And we're inviting funders of all kinds. So whether you're a corporate foundation or an ultra high net worth individual, a C-suite executive, that you would be part of the solutions in bringing funding to the space. If you're interested in knowing more about how you can get involved with Mindful, or if you're interested in downloading any of our reports that are on our website, you're welcome to go to mindfulphilanthropy.org to find out more, and to also learn more about our convenings that take place across the country. So thank you so much for having me today. It's been a wonderful treat to share a little bit more about our work and how overall workplace well-being can be a catalyst for communities, families, and our society to thrive overall. Thank you.